Hey Jordan, I'm Andrea from PT. I'm here to assess your breathing a little bit today. I understand you have some COPD going on, so some obstructive breathing issues going on there.
Yeah.
Tell me a little bit about your pain today. Any pain with it?
I wouldn't say pain, just annoying.
Just annoying? Okay.
Yeah.
So on a scale from like 0, where you can breathe totally fine, to 10, where I need to take you to the ER right now because you cannot breathe, how we feeling on that scale?
It's not that bad. I'd say like a 3.
Okay, so definitely more on that annoying side.
Yeah.
Okay, so I'm going to take a listen to your lungs. Do you mind if I do that?
Sure.
All right, cool. So I'm going to go ahead and pop this in. I'm going to go from a couple different angles and just kind of compare what I'm hearing, okay?
Sure.
All right, so I'm just going to have you sit up nice and tall. We're going to go ahead and place right over the sternum here. Take a nice deep breath in and out. All right, so I'm going to come right over here to the top of this lung. This is our left lung. Nice deep breath in and out. Perfect. Let's go to that other side. Compare it. Nice deep breath in and out. Beautiful. Let's go about halfway down. Nice deep breath in. This is our middle lobes and out. And go ahead and do that over here. Alright, so a little bit quieter than up here, but that's pretty typical. What happens is when we breathe in, most of that air is going to go here, and then it has to disperse as it goes down those lungs. So I'm going to come over here to the bottom of this lung. Take a nice deep breath in. It's getting a little quiet over there, but that, again, is normal. Alright, perfect. Let's check this one. Nice deep breath in. And out. So I'm hearing a little crackling going on. So that's pretty common with someone with an obstructive breathing disorder as yourself.
Yeah.
So usually what happens with that is we breathe in, can go all the way through our lungs, and when we breathe out, that's where we're getting all that exhalation of any buildup in there.
Yeah.
Okay? So usually when that happens, if you're having trouble breathing all the way in, sometimes a little fluid buildup can go on. Alright, does that make sense?
Yes.
Okay, so you can't breathe everything all the way out, kind of condenses.
Gotcha.
Right? Alright, so let me teach you a little bit of a breathing technique that's going to help you to get a little bit more oxygen in those lungs, and hopefully it should help to clear that out a little bit. So what I'm going to have you do, I'm going to demonstrate real quick. So
Sure.
come down here with you a little bit. So we're going to go ahead and sit up as tall as we can, puff our chest. We're going to breathe in nice and deep. So let me go first. I'll show you exactly what's going on. So nice deep breath in. You're going to hold it for a second. And then you're going to breathe in as much more as you can. And then all the way out. Alright, so when you do breathe in, I don't want you to just raise your chest. I want you to try to breathe in through your belly. Alright, so
Okay.
go ahead and breathe all the way in.
Sure.
Yep, there you go. So nice and tall, breathe all the way in, fill that belly with air. Hold it for a second. And now breathe in as much more as you can. And go ahead and breathe out. Perfect. Do you feel like you got a nice full lung of air there, or did it kind of feel restricted?
It felt a little restricted around the sternum, but definitely lots of air.
Okay.
Yeah.
Beautiful. Yep. So we're going to have you do that a few times a day just to really focus on trying to get a little bit more oxygen in those lungs, hopefully clear out a little bit of that fluid and get rid of those crackles, as I called them before.
Sure.
Make sense? All right. Do you have any questions for me?
You said fluid in the lungs. Is this like pneumonia?
So not quite like pneumonia, no. What usually happens with pneumonia is there's some kind of infection going on. There's not an infection here.
Okay.
Most likely. I understand that you've probably checked in with your doctor, so that's why we're here. We're trying to work on those breathing muscles. So we're trying not to use, these are accessory muscles up here, and a lot of times if you can't breathe, you're gonna breathe a little bit higher up as opposed to using those rib muscles and your diaphragm, which it helps the lungs to inflate. When they inflate, the diaphragm goes down.
I got you.
Make sense?
Sure.
Awesome. All right, thank you.
Thank you.